Happy New Year! My name is Apioko and this is Diplomatic License right here on City TV. Now I'm sure you're wondering where I am. No, I'm not in my office. But I am at a very interesting and a very special office. And it is the office of the head of the mission of the WHO to Ghana. Okay, we say he's a country rep. There are lots of interesting names. So basically he's a boss of the WHO in Ghana, the World Health Organization. Now, we've been hearing the name of this organization across the past 2 years. In almost every news item we read or we hear or we watch, it's there. But what does it mean to work in that organization? And indeed, what's the life of somebody who represents that organization in the country of Ghana like? We'll be getting into those conversations and more. And of course, speaking more to the man, and I'll tell you his name when we return right after this break. Welcome back. If you just joined us, this is Diplomatic License right here on no other place but City TV. And my name is Apioko. Now it's time to introduce my guest. I did say earlier, in case you missed it because you're late, but it's okay, not too late. My guest today is the head of mission. He's the country rep of the WHO, the World Health Organization, to Ghana. His name is Dr. Francis Chisaka Kasolo, and I hope I got that right. He will tell me once I bring him onto the camera. Hello, Doc. How are you?
Good morning, good afternoon.
Good, hello.
Yeah, you got it right.
Thank you. Now, you are from Zambia, right?
Yes.
Yes, so a brother of the continent, and
yes.
you know. But okay, so we're at your offices. Thank you very much for having us. And this conversation has been a long time coming.
Yes.
It's fine. We're in the office. The phone rings. You know, you're at work.
Sorry.
So,
Dr. Ohini, I'm in an interview. Sorry.
it's fine. I told you he's at work. It's fine.
Sorry for that. We continue to work even during the interview.
It's fine. But you are a very busy man, and all the more reason why I appreciate, I'm sure our audiences do as well, you're making time to have this conversation, to spend time with me. And we'll be doing this for 2 weeks, right? Yeah. We'll be doing this for 2 weeks. So let's start talking about how you ended up at the WHO. You're from Zambia.
Yes.
And I will let us talk a little bit about what it was like growing up. I want us to start from somewhere in the middle. I mean, I'm a literature student.
All right.
And we call it in medias res,
yeah.
where you start the story from the middle. So let's start in the middle. How did you get on this journey to diplomacy that brought you here?
Well, thank you very much, first of all, for affording me an opportunity to sit with you and have a discussion and share some of my experiences in life. I joined WHO more or less by accident. Oh. I had spent quite some time, almost 10 years in the United Kingdom. Okay. So one morning, I woke up and told myself, look, this is not what I want in life. Let me go back to my country.
But what were you doing in the United Kingdom?
Initially, I was studying, and then I started working.
Okay. Of course, you're a medical doctor.
As a medical doctor, okay. Public health specialist, but also a clinical virologist. So okay. One of my hobbies was to collect qualifications. We'll come to that. But
I think that's a very African hobby.
Yeah, really trying to get as many qualifications as you can. So I got back home and I joined the what they were calling the University Teaching Hospital. Okay. And during that time, the University Teaching Hospital in Lusaka, Zambia, was the tertiary service that provided from curative to public health support to the government. And for about a year and a half, I got involved in a number of international programs to do with HIV, to do with immunization, but also to do with the outbreaks. And this brought me close to WHO, especially
so
the
Doc,
immunization.
This was around which year?
That was in, I got back home in the year 2000.
Okay, I'm asking because I know on the continent, 99-2000 became the HIV conversation time.
Exactly.
So I was wondering if that was
That
the
was
timeline.
part of the reasons. A lot at that time in my country, HIV was just through the roof. We were seeing what we're calling floor beds in medical wards. The number of sick people with HIV were so many that when you watch on television, you get the feeling you just had to go home and help.
But what was causing it?
Well, people not believing that HIV existed. If I take you to 1983, when I was in medical school, I saw my first case of HIV while clerking on the ward. But even then, people never believed that HIV had come because we were being told through the media, unfortunately, that HIV was a disease of a certain group of people.
Yes.
And so if you don't fit into that narrative, you tell yourself you can't get HIV.
Exactly.
So it spread so much that in my country at one time, and around the time I was getting back to Zambia, we had almost 23% of the antenatal population testing positive for HIV. And you know how big that challenge would be. So when I got back, such programs like HIV, immunization, polio, outbreaks brought me close to WHO. And then linked to that, we were going through a transition and change in government. A new president had come in. He had new ideas and he wanted things done differently. So we continued working, and 2 years along the line, a Nigerian professor who was the head of surveillance in WHO was going on retirement. And at that time, I had more or less rubbed everybody's necks or shoulders because one of my traits was to tell the truth as I saw it. And I know most of us don't want to be told the truth.
No, we don't.
So
it hurts too much.
So I decided to go on leave. And the second day on going on leave, the Nigerian professor, Professor Tomori, called me. I'd worked with him on various projects, WHO projects. He called me and said, look, I'm retiring next week, and I've been told by my boss to headhunt somebody who can fit my profile of qualifications and experience. And I think you fit that profile. Are you interested to come first of all for 3 months, and then if you like it, you then can apply and stay? I had already taken the leave from my government. I was up to here with the working with some people in my country. So I said, okay, I'm already on leave. I've taken 3 months off. Let me come and see and then make a decision. And fast forward, got to Harare where the regional office had moved temporarily then. That's 2003. And, well, I just did my work. And then when my contract was coming to an end, the director in the department I was working, Dr. Antoine Kabore, he's retired now, he's a Burkinabe guy, called me to his office with my immediate supervisor. He says, look, when you were coming, I was skeptical on whether you were going to fit the shoes of Professor Tomori. This is an experienced guy who has done a lot in public health in Africa. But you seem to be a disciple of Professor Tomori. What you say, what you do is exactly what... I said, yeah, I've worked with him, I understand this program. He says, I would want you to apply for the job. So that's how I applied for WHO job. So again, it was by accident. It's not that I saw an advert, but it's this great man, Professor Tomori, that offered me this opportunity to come and work briefly as a consultant and then applied for the job to take over from him as the head of surveillance in WHO.
So how old were you at this point, if you don't mind me asking, Doc?
Oh, I was...
So this must have been about 2002, 2003?
2003. I was born in 1964.
Okay.
So I was probably about 39.
You're young.
I was quite young,
You're
yes.
still young. But you managed to make such a mark that you rubbed a lot of government people at home the wrong way.
Yes, it's...
You know. Was it the youthful energy?
It was the energy I came with from the UK. I came from...
You wanted to make a difference.
Exactly. And this rubbing was not because of anything. It's just the way I looked at things. I can sort of explain exactly what happened. Again, it's the HIV story. At the height of HIV, there were a lot of people coming up with what you'd call treatments and cures. So we had a Chinese man who had come into the country and said that they had developed a cure for HIV. And this man set up what they were calling a Chinese clinic. And we used to have queues, cars coming at 6 in the morning. And so one day, sitting in my office, my boss in the hospital calls me and tells me that the president wanted to meet Zambian experts to discuss something. So, and that was around 2001, mid-2001. We go to State House, which is the equivalent of the Jubilee House here. And young man with an old professor who had gone with and two others were faced with half the cabinet. They were discussing how they could change the public health, or rather the laws, to allow for these Chinese and some other herbalists to take over two floors in our main hospitals so that they start treating HIV.
Huh. But had there been any tests, any feasibility studies?
No studies had been done, nothing.
So it's just
this
these
guy,
people telling you it works.
It works. And apparently he had treated people that were connected, and so they agreed that thing. So we sat in this meeting. I kept quiet because I was just invited by my boss. Fast forward, about to make a decision to say we give 2 wards for HIV to these 3 gentlemen, Chinese, to be treating patients and so on. So I put up my hand.
You couldn't take it anymore.
No, because for me, I was probably naive. This is a cabinet with ministers and some senior civil servants making this decision, Attorney General seated. So I put up my hand and I said, then the president looks and says, yes, young man, you want to say something? I said, oh, yes, Your Excellency, I've been following this discussion. My name is Francis. I came with my boss here, Professor so-and-so, and I just would want to make a contribution. And my contribution is maybe we shouldn't rush things. Before I even finished, my permanent Secretary of Health says, that's the problem with the Western trained clinicians. No, they don't allow. I said, no. For me, I was nothing to lose. I just said, oh, no. But my take on this is, I'm not disputing that these things are working. So I quickly used my little social psychology I'd learned in medical school to simply say, this will be a breakthrough for the country. The country was going through a lot of economic difficulties then. I said, do you know, Your Excellency, if this thing is done well, the Americans, the British, the Japanese will be flogging to Zambia to come and get the cure. So my suggestion is that let's look at it in a small controlled study. And this controlled study will give us enough information for us to be able to say it works. We can even expand, or you can even bring it up in terms of your membership to the Southern African.
A good case study for good marketing.
Exactly. Okay. So the president bought it.
Thank you,
Fast
social
forward,
psychology.
6 months later, then he says, okay, I want to make you to be in charge of this study. I said, no. Give somebody. Because I knew if I was the person leading the study and the results were negative, they would come and say, oh, he studied. So I said, don't give it to somebody. So fast forward, it turned out whatever they were giving was causing renal failure to patients. People were dying from kidney failure. Yes. So they owned up. There was a change of government, a new president came, but the players who were pushing for that still continued, and I just told myself, look, I'm not going to continue with this kind of thing. I think I need to take a break, because the 3 years I'd come from UK and worked in Zambia, I never took leave, and that's why I took leave. I said, more or less to cool off and make a decision.
Reset.
Yeah. So it was like that. I mean, HIV was a money spinner for most of our herbalists. People that had never seen a case of HIV were saying they were treating, and they were making money. And so the Chinese man made a lot of money and then suddenly disappeared from the country.
Without a trace.
Yeah. No, he disappeared. I don't know where he went, but he packed and went, but after making a lot of money. Yeah.
So I can understand how you were feeling in 2003 when you were invited to work at the WHO for 3 months, so that you could see whether that decision was for you or not. But in those 3 months, were you in a space where that initial fire that was burning within you to make a change in your home, on your home continent, was that rekindled, or you were really just exploring something? What was your state of mind?
Initially, when I joined, it was more to pass time. But then the work that WHO does gets to you emotionally. And at that time, we were fighting a huge outbreak of polio. And you see, when you then visit countries and see these young children who are deformed or have had polio, you then start thinking, maybe my calling is to help the general population in Africa rather than stick in my country. So I transitioned from just passing time to really appreciating some of the real changes that WHO was doing, and one of which was in polio. And during that 3 months, I had the privilege of visiting Nigeria and the DRC, where we had the high incidence of polio. And because of that, I thought maybe this offer being given for me to apply, I'll apply, and if I get it, I'll stay on.
Wow. Okay, Doc, I mean, we're in your office, but the WHO offices encompass so much more. So I want us to take a walk around so that people just get a feel of what it's like and what it looks like. So I'd like us to take a break, and when we return, conversation still continues, because look, I've had conversations with this man off camera, and look, his story, it's like a movie. So we'll definitely get more into that when we return here on Diplomatic License. Okay, thank you. Mask on.
So I was saying, this is our office for the last 3 years.
Okay.
We moved here from not far from here. If we could first see
this way.
my boss.
Okay. Knock, knock. Hello.
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 Hi.
Hi.
So this is my peer, Cindy.
Pleased to meet you, Cindy.
Cindy does all the heavy lifting on my behalf. An excellent person.
Cindy, your job must be very difficult.
Sure, but it's manageable.
No, but she's really an example of Ghanaian excellence. I always tell people that in Ghana we have very good human resource capacity, and this is a typical example, an excellent PA.
Thank you, Cindy. You're making Ghana proud too.
Yeah.
Thank you.
Thanks, Cindy. Thanks. And she actually organized, she also organized this interview. She's the one that you've been dealing with. Yeah.
Thank you, Cindy. Thank you so much.
Thanks, Cindy. So, yeah.
We'll see you again. We're getting to know the rest of the team.
Yeah. And one of the things that WHO has tried to do in Africa is to grow the Ghana office.
Okay.
Because of the strategic position of Ghana, the decision has been taken to strengthen the Ghana office so that it also supports 3 other countries, which is Liberia, Sierra Leone, and the Gambia.
Okay. But Doc, what is it that makes Ghana so strategic?
There are a number of issues, but the first one, which is key, and we alluded to it, is the fact that Ghana has a very strong human resource base, which most of the countries in the sub-region do not have. But also we have...
What's the reason for that?
Well, Ghana invested in education.
Of course.
But also over the years, Ghana institutions have become centers of excellence. And so they've been channeling out very, very strong human resource capacities, not only in health, but across the breadth of education. And the next is the fact that we have strategic institutions here, such as the Noguchi, the KCCI, and so on, which are doing excellent work, which is really regional work. And so to try and work more closely with them,
But also when COVID started, a lot of the samples from across
exactly
the
were
continent
brought
coming
here. Yeah, they were brought here. So those 2 key issues, in addition to the fact that obviously Ghana presidency now is the chair of ECOWAS and our Minister of Health is the chair of WAHO, that strategically Ghana is in a position for us as WHO to work through them in order to bring to fore the health challenges of the continent. And so really this office has now become kind of strategic in terms of not only looking after supporting the ministry and government in Ghana's health, but also looking at other countries like Liberia, Sierra Leone, and Gambia. And because of that, we've now had to employ what we call the Partnership and Resource Mobilization Officer. Zumbra, hello.
Hello.
Just 1 minute.
Hi. Sorry to disturb you.
This is colleagues from CTI TV. They've come to give an... Yeah.
Oh, they're like, it's a World Bank
okay, so
conversation.
Yeah. So Zumbra just joined us. She's coming here to work with us to try and ensure that whatever we are doing is in synergy with the different health partners, the UN, but also the government. And at the same time to ensure that we are able to identify resources that can support some of our work with the government. So she's a significant addition to our office.
Pleased to meet
So
you.
happy to be
Maybe
here.
one of these days we can spend time with you as well. That would be
Yeah, sure. You talk about that. So thanks. We're going around. Yeah,
Sorry
please.
for disturbing your meeting.
Okay, thanks. Yeah.
Okay, so we're going this
Yeah.
way. But Doc, I mean, you've said some very exciting things, at least things that I'm excited to hear, because yes, we have created centers of excellence education-wise in Ghana. Yes, we know the strength that I held. I mean, you go to Kolebu and you see the cardiothoracic center, for
Yes.
example. I have seen people even from Europe travel to come and have procedures done here.
Yeah.
But we always talk about the challenges that our health sector has. So for the WHO to be present and also provide support to the government, be it logistical or even in terms of capacity building.
Yeah.
I'm very excited to hear that.
No, it's our role. We are what we call a member state organization. In other words, our bosses are the government. They tell us what their priorities are, and we as an organization respond to support those priorities that they're talking about. WHO would not wake up one day and say, we want to do this in Ghana, but rather we listen to the strategic advice that comes from government to say that they want to invest in this area of health. For example, most of the issues, it's not just us supporting, but most of the other things that we are hoping to get out of Ghana is their experience. For example, Ghana has one of the strongest regulatory agencies, the FDA, on the continent. I think it's only Ghana and Tanzania that have reached a certain level of excellence according to WHO criteria.
That's impressive.
Secondly, we also have one of the longest health insurance schemes. And so working with Ghana, they can share that experience beyond their borders to show people how they have transitioned through the time to get to this level that they've achieved. Yes, health is expensive. And that's why we always preach as WHO the fact that we need to look for alternative resources to invest in health. And one of that is, of course, the health insurance. The more people pay for health insurance, the more resources become available to treat those that do not, cannot afford it. But also investing in promotive and preventive health. It's always the adage of saying prevention is better than cure has not been is more important now. So, for instance, we've been talking about wearing masks for COVID. Yes, why? Because we don't want people to fall ill and then end up in Kolebu or the infectious disease centers and so on. But rather, if you avoid getting COVID by wearing masks, by being vaccinated, you cut down on the cost of looking after you in the facility. So that's how we work with the governments
So
and
it's
Ghana.
not just about the individual, but
No,
the system.
it's a system.
So preventive health is not just about the individual, but about
It's the system, the community. The community, for instance, just mere washing hands reduces the risk of people getting diarrheal diseases. So if that message can be taken to the community to appreciate that, you then prevent some of these hospitalizations that cost a lot.
Huh. Interesting.
Okay.
We're also getting a crash course on public health today. We're an expert, very much an expert.
So I think our colleagues here, who's here? Ah,
Knocking. Hello. Okay, since
Our
we're in Ghana,
ra-
I'll say I'll go.
Ago, yes, this is another example of expertise. This is our colleague Rafik. Rafik has been working on the malaria vaccine.
Okay.
He's just come back from Geneva, where we had we were asked for him to go and work there briefly to help them work. So they're the
Rafik, you're a big man.
they are part of the team that really did the back-breaking work of the RTSS vaccine. The recent one, which they announced that the malaria vaccine, that we're now going to move to introduce malaria vaccine.
Yes.
So he's one of the
It's
things.
an honor to meet you.
So don't read.
Congratulations.
So when BBC, CNN talks about Ghana, that we're part of a study, it's not just that our children were used, but we also had Ghanaians,
Yes. Who are
experts who were running and working with those studies. So this is an example again of.
Rafik, congratulations. Yeah.
So
nice to meet you.
so we have quite a team. I think today it's about them. They are the ones that are making WHO an organization. For me, I've transitioned to helping them. Rafik, thanks a lot.
Thank you,
We'll
Rafik.
catch up. Yeah.
Sorry for disturbing you. Please keep doing all the malaria work.
Yeah.
We'll see you.
So these are some of
Thank you.
the things that we do,
Well,
and
this is so impressive.
yeah.
And
We have at the moment almost a total of 60 staff.
60.
Yeah.
But that's quite a number.
It is a number. So what we have
Especially
then,
for an office, a country office.
a country office. But like I said, what has happened now is we have transitioned into having a group of staff here, experts, brought in to help support the other countries I mentioned, Liberia, Sierra Leone.
Of course.
And so because of that, we've set up an annex
Okay.
to this building.
So that's where we are going.
That's where we're going
Okay.
to.
So this is the main building.
This is the main building. This
And-
is our
and-
main offices.
Okay, and these offices, when do we start using this premises?
This is 3 years ago.
Okay.
And then where we are going is the last 6
Last
months.
6 months. Okay.
Yeah.
Wonderful. Wonderful. But I mean, it's very encouraging. You know, a lot of the time, even being in the media, just having access to certain information makes you feel as though Ghana is not doing so well on certain fronts. But
Yeah.
I've learned a lot of things from you today, and indeed from your staff that are proving otherwise.
Yeah.
And that makes me very happy. I'm sure. Hi guys, those of you who are watching us are also very excited to hear that, and proud. It should make you proud. But so we talk about Liberia, Sierra Leone,
and the Gambia.
and the Gambia, and the support that the Ghana WHO office is giving to them.
Yeah.
What kind of support and how is that working? I know you brought in, like you said, some people, experts to come and support the effort, but what exactly are we doing to
We
support?
have now set up what we call multi-country teams.
Okay.
These are experts that are based in Ghana,
Okay.
whose role is to mobilize human resource within Ghana, but elsewhere, to work with and directly support these countries. So, for example, if Sierra Leone wants to develop a national plan on health, this team comes together, including some of the colleagues, the Ghanaian colleagues that have already been in the office. With these video or Zoom platforms now, they will then be discussing, but then they then physically go there to support them, to build capacities and competencies.
So they'll go there for, let's say, 6 months, a year.
They'll go there for 3 months, depending on the
on
needs.
the needs.
And then they come back. But there are mobile teams that are moving around the sub-region to support. And all of these teams are based here.
Okay. And
So-
this capacity building involves training,
It's
setting up.
setting up systems, evaluating performance, and monitoring changes in trends of diseases, all that. So it's across
lot
the
of work.
spectrum. It's in health systems, it's in malarias, in TBs, in all the infections and so on. So it's a lot of work, and that's the beauty of being here also, that in Ghana, the link with the other countries by air, for instance, is just 2 hours away. So if an emergency comes up, these people can get a ticket and fly to these countries to support them. So our annex are here.
So we're crossing the street.
We're crossing, the street.
Okay.
Let's be careful.
All right. There you go.
It's really a good day today. It's not.
is.
I
Hello.
was worried it would be that hot.
It's not that hot. It's actually
No,
quite
no.
sunny, but there's
Yeah.
a lot of breeze.
So this is our annex. We'll go into where the lady is.
I thought it would be blue.
We are renting. And you know, when you rent, you don't change
No,
colors.
you
The owner
cannot.
decides what color.
Of
But
course.
S color is okay.
No, it's fine.
Yes.
It's so bright. One of my favorite colors anyway. So
This color, yeah.
Yes.
Yeah, please.
thank you. Hello.
Madam,
How are you doing?
how are you?
We're invading
Okay.
your space. Small.
So this is our annex. Maybe we'll go through. Yeah. So like I said, when we started expanding as an office, we needed space. And then so fortunately, this space was available, and we, being just a stone throw from the main building, we got this.
Okay.
And here we have mostly the technical stuff dealing with maternal health, with health system, financing, and so on. Yeah, so we'll go through the kitchen.
Okay. So when you say technical stuff, how?
These are the experts in
Okay,
the
so
field.
these are the
The experts in the field. Oh,
Sanitizer.
hello.
Thank you.
Hello.
Knock knock.
I think
Oh, they'll be upstairs.
they should be up there. So we have the room here,
Okay.
but also upstairs here.
So a lot of research goes on here.
This is a lot of what you call strategic thinking.
Okay.
Yeah, so it's a lot of strategic thinking, and I hope our ladies. Hello.
Oh, they're out.
Hello.
Oh.
Ah, okay.
Knock knock.
Ah, Sophanias.
Hello.
Okay, Sophanias is our team lead for what we call universal health coverage
Okay.
life course. He's running or heading a very big team looking after issues around governance, issues around health governance, not governance,
Health governance.
health governance, health financing, the general health system, medicines. Yeah.
That's a very,
Yeah,
very
so he's-
special area
yeah.
you have there.
So he's one of the staff here. The others, I'm sure, are either in the field or are coming back from holidays.
Okay.
Yeah.
But Sophonias, are you from Ghana? Or
I'm from Ethiopia.
Ethiopia?
Sorry.
Okay.
Yeah.
Nice to meet you.
Oh,
Hello.
and Innocent.
Hi, Innocent.
Dr. Innocent, they're both medical
Okay.
public health
Then
experts.
please let me address you properly. Doctors.
Yeah. Innocent is one of the, you remember I was talking about these new stuff that are going to cover the 3 countries.
Yes, Liberia, Sierra Leone.
Yeah, so Innocent is in the area of maternal and child
Okay.
health.
A man after my own heart. Yes.
Oh, thank
Yeah.
you.
Well, I have 2 kids, so I have a very interesting.
So you are steering the life course.
You
Yeah,
understand.
the life course, yeah. From birth.
But
to
yours
death.
is important too because
Yeah.
the money we spend, you
So
know,
the-
Give us
yeah,
the
it's
money.
important. We need
Yeah.
it.
Yeah. So putting together this team and really working with the government for me is they do the work, but we all work as a team, and my role is really to ensure that they have the resources and access to some of the offices to make their work. Yeah.
Wonderful.
Yeah.
Congratulations.
Wonderful people.
Congratulations.
Innocent is from Uganda.
Ah.
You know Uganda?
Yes,
Of
I
course,
do.
Yeah.
The power of Africa.
The Pearl of Africa, yes. And then
I knew I was going to say that.
so this office we have, you know, WHO does not segregate. It employs
course.
anybody who fits the bill.
Definitely.
Yeah.
And I hope you all like Ghana.
Oh, he's been here longer than me,
Easy.
so
They have been here longer than me.
Than you.
yeah.
They should first say whether
They
they
like it or
For
not.
me, I have it so far.
Yeah.
So these are the some of the our office, the annex offices. On a busy day, it will be quite busy and full, but we're coming back from holidays. But some people are also in the field.
Okay.
I think the meetings that have already started with the ministry and partners. Yeah.
Makes sense. Gentlemen, thank you for allowing us to invade your space a little bit.
Always welcome.
Yeah.
Thank you. My name is Apioko, by the way.
Up here.
And your crew.
Yes.
Yeah. Okay, guys. Thanks. So these are our offices.
Okay. So this particular building, just about 6 months.
It's 6 months.
Okay,
We've just
Thank
came
you.
in 6 months, but certainly.
Thank you.
Thank you, madam. We were looking at this, but
Well, you were looking
eventually-
at this one.
Yeah, but
Okay.
eventually it wasn't available at that time.
Oh.
But we are okay. I think the good thing in working out of Ghana is you have choice in terms of offices. All
That's
you
true.
need to have is the money,
Well, you see,
but you have choices. And
it's not like that in Zambia.
no, Zambia is the same. In fact, Zambia is built or modeled around Ghana.
Okay.
Our
That's very interesting.
Our first president, Dr. Kenneth Kaunda,
Kaunda,
was
of
a
course.
protege of a friend and a student of Kwame Nkrumah.
Of course. He's
So
a
everything
legend.
Kwame Nkrumah did, Zambia copied. From industry, we had the same industries, we had the refineries, so everything Kwame Nkrumah did, Kenneth Kaunda did. So when you get to Lusaka and the principles and the philosophies, most of us who lived during Dr. Kaunda's time relate very closely with Ghanaians of our age.
Absolutely.
And I'll tell you a story when we sit for the cycling later.
When we get on our bikes.
Later on
Doc is
on
making me
how-
ride a bike for the first time in a while.
on how the a Ghanaian professor encouraged me to go to the UK, got me a scholarship and got me a wife.
Wait,
in Zambia.
wait.
Yeah.
So your life as it exists today,
No. The Ghanaian
Ghanaian professor.
got me a scholarship when I finished medical training and got me a wife. I'll tell you more when we are
I
cycling.
can't believe this.
Yeah.
I can't believe this.
So my link with Ghana is legendary.
It really is. It really,
Yeah.
really is.
So yeah.
Doc, so it's about time to go cycling. no?
Yes.
Okay, so you have to go and get your
Yeah.
things.
So give me time to just go and
Okay.
get home. We'll meet at home, and then I'll change my clothes into my cycle.
Okay,
I hope
alright.
you bring your bike.
Yes, everything is in the car.
Okay, great.
I'm ready.
All right. So later we'll continue this discussion.
Yes.
And nice, we've had this discussion.
It's
But we'll
brilliant.
continue. There's more where it
Absolutely.
came from.
No, I can imagine.
Yeah.
No.
All right then. Quiet.
Thank you.
Ciao.
All right, ladies and gentlemen. So I have been spending time today with Dr. Francis Chisaka Kasolo. It's not done, by no means so. We're going to ride our bikes now. So we're going to his place. We'll do some riding in his estate, and then we'll sit down to a meal before we wrap up this episode. So just stay tuned. More to come. We'll be right back. Welcome back. You are still watching Diplomatic License on City TV, and now it's time for Doc and I to take that bicycle ride that I spoke about. If I fall, we're trooping it because I haven't ridden in a long time, but at least I have my bike, so you know that I'm serious about this, and maybe it will become my hobby. Maybe I'll be riding with Doc. So let me just go pick him up. I'm at his house now. Lovely, lovely home. So I'm just rolling my bike over. Oh, there you are.
Hello.
How do I look?
You look really a postman like, a
Don't be
postwoman like.
deceived.
Let me get my bike. You've just come at the right time. The last time we met, we had to rush back here to
Yes,
try
yes,
and
yes.
get ready. But fortunately, we are all set.
Okay.
Okay, so I will get you. I mean, I'll take you around on the easier route.
All right. All right.
I'm sure you.
You're having some pity on me.
No, myself as well.
Okay.
Okay, so we go.
So we go.
Yep. I hope you your brakes are working.
Oh, yep.
Excuse me.
Nice.
Yep. So how's been your day?
Oh, very long.
Very long.
After we parted,
Yeah.
you know, and I'm sure you had to wrap up in the
I had to wrap up in the office and then rush down here. Yeah. So I think it's.
At least the Spintex traffic wasn't too mean to us.
Oh, I mean, traffic here on Spintex is always mean. So thank you.
Okay. Thank you.
All
Get
right.
over the bump first. Okay.
Okay. It's okay.
All right.
So we're going to turn, as we take our time,
We're turning right.
we're turning right, yes.
Okay.
And then it's a bit smooth on the right. Okay.
Got it. Oh, this isn't so bad.
Just take your.
So, Doc,
Yes.
let's talk about your childhood.
Yes.
I mean, of course, we know you're from Zambia.
Yes.
So, which part? And what was it like growing up?
Well, I come from the northern part of Zambia in a province. Initially, the province was called Northern Province.
Okay.
Then it was divided into two. It's now called Muchinga and Northern.
Muchinga and North.
Northern, yeah. My parents both came from the northern part of Zambia, about 120 kilometers apart.
Oh, practically the same place.
Well, those days it was apparently
More difficult
difficult
terrain.
and difficult to marry.
Oh, wow. Interesting.
If you tended to marry somebody from your own village. So
I see.
my mom comes from a place called Impika,
In Pika,
and then my dad comes from a place called Chinsali.
Chinsali.
Chinsali is where the late first president of Zambia was also born.
Okay,
So we are sort of district mates.
okay.
And I was born in Chinsali. My parents were teachers.
Both of them?
Both of them in the colonial days. So that's where I was born. Independence. A policy was brought in to move civil servants around.
Okay. And your parents?
My parents then
That's
moved.
the whole
Yeah, so they went around all different provinces of the country, and then I went to school, started school. It's called the Copper Belt. That's where the copper mines are in Zambia. Then went to western part of the country, eastern part of the country, and then eventually came to the capital, Lusaka, where I did my last years of primary school and secondary school and university.
So you've lived in almost every, in terms of directional axis, north, south, east, west.
I have,
Central.
exactly. I've lived in almost all the provinces of Zambia, and I speak all but one of the major languages.
So how many major languages?
There are 9 major languages, so I speak 8 of them. Yeah.
Can you name them?
The major languages are what we call Nyanja, Tonga, Lozi, Kaonde, Luvale, Lunda. We also have languages, 2 Lundas in fact.
Okay.
One is next to DRC, the other Lunda is next to Angola.
Okay, so anybody
Say-
who lives in DRC
Speaks
can speak
the-
that Lunda.
Yeah, just like anybody who lives in the eastern part of the country speaks the same language as Malawi
Okay.
and parts
so
of
similar to
Mozambique.
how we have people from the Volta region.
Exactly, it's the same. Yeah,
Togolese.
yeah. So sometimes you don't know where somebody comes from if they tell you the name. The names are very similar, both in the northern and then DRC and then eastern and Malawi. Yeah. So then I did my university in Zambia. I did medicine. Initially, I wasn't supposed to do medicine. I was told my parents I was doing medicine, but then started engineering.
How did I even? So okay, so
Because
back-
all-
so I'm guessing that when you were in primary school, high school, your favorite subjects were science.
Well, sciences, maths, science. Yeah, those were the subjects I liked.
Okay.
Yeah,
So how did you end up doing engineering?
So all my friends, when we finished high school or secondary school, all my friends were doing, decided to do engineering. So part of the crowd joined in, spent 2 months doing engineering. Then my father found out I was doing engineering,
How happened?
took me back to the university. Fortunately, the dean of the School of Medicine was my father as a student.
But what happened? How did he find out?
Because when we went home with my friend.
so
my
conversation.
So I sort of left the living room to go. I don't know whether I don't know. My mom wanted me to go and pick up something to save my friend. So then I'm asked. My dad is talking to my friend. So how's medicine? Say, oh no, it's medicine. We are doing engineering. So that's how I was found out.
Oh Lord.
But fast forward, I then did my
Was
medicine.
he upset?
He was as a parent because most of my brothers did engineering. So he wanted a son to do medicine.
Medicine.
Yeah. So
But what were your parents teaching? Was he a scientist himself? Or?
no, my dad used to teach languages.
Okay.
My mom was a primary school teacher, so she was a generalist. She taught
Okay.
most of the things.
Okay.
Yeah. But just also, you see, those days we used to listen to our parents. So I
You
fell
don't
in
You
line.
don't fight. You
Yeah.
don't talk back.
No, so I fell in line and went to study medicine. And so it was. But generally, I grew up in a Christian home, strict Catholics. Fridays, we would not eat meat. We would go to church, all of us on a Sunday. So, in a way, In a way, that was my life.
Your life.
Really, my dad was quite strict, but my mom was an angel. She allowed us to get away with a number of things.
So how many siblings do you have?
We are 8 of us in the family.
8?
Yes, and
Same father, same mother.
same father, same mother. We don't have any half brothers.
And you're all boys.
No, 7 of us are boys and 1 girl.
It's the same thing.
7 of us are boys and 1 girl. So, but otherwise, we grew up with a very close-knit family. As
Please,
Africans,
let me not slow you down. No, my legs are not used to this, so
Yeah,
let me ride. I'll walk with you.
now we can also walk. Don't worry. When we start going down, then we up. So my family, as Africans, we had extended family staying with us, from my father's side, from my mother's side. So it was when we talk of
Cousins,
family, cousins,
Uncles,
nephews.
all-
Yeah. So when we talk of family, sometimes I hesitate to say we are 8 because
and we
African
always-
families,
and
yeah.
A cousin is still a brother or a sister.
exactly,
A
especially
nephew and niece is a son or a daughter.
yeah. I come from a matrilineal group of people, ethnic group, where the children technically belong to the mother. So my mother's brother,
But you
my
don't inherit your mother's surname.
no,
Okay, but
it's a father's surname.
okay.
Let me put it this way. Previously, we used to have your own name, and then until after before I was born, when the British started teaching, they changed everything and brought in the surname. For instance, my dad's, if he was to use his surname, it would have been Chanda.
Chanda.
Yeah, Kasoro was my grandfather's nickname, which was given to my dad.
Okay.
So when things changed, he became Kasoro.
Kasolo.
And all of us are Kasoro.
So your dad actually lived through that time when it was normal to be giving your own name.
Yes, oh, he's 97. He's 97 years old, and that was the life. Yeah.
So so if you're Chasanda, that would-
Kachanda.
Kachanga.
Yeah.
So that would mean that then you
I will have my
have
own
your
name.
own name.
Yeah. And that's why my middle name is Chisaka.
it's Chisaka.
The tradition was to name after significant people in the families. So Chisaka is supposed to be my great-grandfather. Okay, so that's life. So tonight we'll have some, I'm sure when we sit down after this, right?
Much more to talk about.
My daughters and I have put together a rushed meal. So you are invited
Is this
for
a
that.
Zambian meal?
Some of the foods
Or
are prepared the
Zambian
Zambian way.
influence?
Zambian influence, but you see, with my daughters, anything goes.
Of course. they're citizens of the world.
They're citizens of the world, so we will invite you for dinner, so then we can pick up the stories and discuss more. But otherwise, there's more where it came from. I think my life has been interesting.
Absolutely. And there's so much.
Yeah.
But I'm curious, when did you start cycling?
Oh,
And is it for health reasons or it's a hobby?
when I was young, we used to cycle, and the best way, if they send you to the market, there used to be a family bike, so to say. So they will send you, go and buy bread, go and buy things, you go to the market on the bicycle. But then when I went to university and even secondary school, I stopped biking until a couple of years ago when I was involved in a terrible accident. And as part of healing, I was encouraged to ride so that my muscles strengthen, my neck, my legs, and so on. So since maybe now 10 years, I've been regularly biking.
10 years.
Yeah.
10 years.
10 years, yes.
That explains why you have the stamina. My legs are just failing me all over the place.
And, you know, and when I was moving, you believe it or not, when I was moving to Ghana, one of the few possessions I came with was my bike. So
It's that important.
so it's that important.
But I'm
It's,
sure it's also because it has some nostalgic attachment
I
to.
think
You're
so.
saying that growing up.
Yeah, growing up,
bike, that's how you move.
Exactly, that's how we
It's a
moved
piece of
around.
home.
Yeah.
It may not be the local bike.
No. It's not the local bikes were more difficult to ride. These ones have
In Ghana,
gears.
we
So.
call our local bikes Buzanga.
Oh, Buzanga, okay.
Yeah, you have the same thing.
We have, well, they were named Luangwas because there was a company that was producing them. So if they say, oh, take the Luangwa and go and buy things, so you jump on it. So there's some nostalgia that at least one of the few exercises I do is when I get back from from work, I come and ride. And fortunately, I live in a place where we have street lights. And the roads are paved, and so really, yeah, so it keeps me going.
Wonderful. Doc, we need to have that dinner and finish this right. So, ladies and gentlemen, I'm still speaking to, of course, Dr. Francis Chisaka Kasolo.
Yes.
Right? Chisaka Kasolo. Now, I was going to mention your father's name.
Peter,
Chisaka. Now, that was in my head.
his original name, if he was to have a surname, it's supposed, like I said, it's supposed to be Peter Chilufya Chanda.
Yes, true.
But Chanda. But my grandfather, during the tax, he used to avoid paying tax.
Your grandfather.
So he had multiple names, and one of his nicknames was Kasolo.
Kasolo. And
Yeah.
that's how.
And if you ask me what Kasolo means in my language,
You have no idea.
it has no meaning. But in other Zambian languages, it means the back.
The back.
Yeah.
Kasolo.
Kasolo,
Back.
yes.
Kasolo.
Yeah.
Well, maybe that's what it is.
Not in my language. I think we've asked and nobody seems to know. He says, well, it's a name.
Interesting. So, we'll be right back. And when we come back, we sit down for dinner. Look, this gentleman, I keep telling you, his story's brilliant. And I mean, of course, we've heard a lot about him and his life with the World Health Organization, the WHO. But we'll talk more about him as a person and how that person fits right into the WHO in Ghana. We'll be right back.